All right, good afternoon, everyone. Thank you for joining us today for our Be Well Lunch and Learn titled Child and Adolescent Wellbeing During COVID-19, Bouncing Back with Dr. Deepa Sekhar. These lunch and learns are sponsored by the BeWell Initiative, which is a product of Penn State Health Human Resources, which works to enhance employee wellness across the system. We do record these so that we can send out the recording in our follow-up email along with an evaluation and a copy of the PowerPoint slides. So if you're unable to watch the whole lecture today and would like to join us again, you can watch that recording. Additionally, we do have the Q&A feature. So if you have any questions, we will get to as many questions and answers as we can at the end of today's presentation. And so with that, I will turn this over to Dr. Deepa Sekhar, who will tell us a little bit more about her and child and adolescent well-being during COVID.
Hello, everyone. Thanks for having me. So I'm going to start out by talking a little bit about ProWellness, because ProWellness is the group that's working in partnership with Human Resources and the BeWell program. And I'm the executive director of ProWellness. The PRO stands for Prevention, Research, and Outreach. We are a center at Penn State managing a variety of educational programming and research, all with a community-based focus. So working with this group is one of my roles, but I'm also a general pediatrician, and I've been here at Penn State for over 13 years now, which I almost can't believe. I have an outpatient pediatric practice over at 35 Hope Drive and also see patients in the newborn nursery, which is really a joyful time for all of us. I will say to you that I feel at this point I've been in practice a while and I'm pretty experienced. And the COVID-19 pandemic for me was one of the first times I found myself scratching my head, really feeling like people were asking me questions. And I was sort of like, I don't exactly know the answer to that. And it was frustrating for a lot of people in that way, right? Even simple things, coughs, colds that we knew exactly what to do with. All of a sudden, it was like, my goodness, could this be COVID? I don't exactly know how we're supposed to manage things. And I feel like at this point, obviously, we're further into the pandemic and perhaps a little bit more comfortable with dealing with some of the uncertainty as part of our regular routine. But it's stressful, and I think it continues to be stressful for the kids that I see in the office, in particular adolescents. And that's really where I wanted to focus on today. And I'm hoping you will leave this talk. I really intended it to be practical. I'm hoping you'll leave with some practical suggestions or some practical ideas about what you could do to support your child or adolescent in the home setting. I chose to focus on the areas of physical activity and mental health because this is where I find I'm having the bulk of my conversations when kids make it in for well visits, and thoughts and strategies in these spaces would prove to be most helpful. So I'm going to start with physical activity and some of the things we've seen with the pandemic and some strategies that may help with dealing with the after effects. So any of you who've looked at the news at all may have seen this little bit about the quarantine 15, sort of like the freshman 15, right? And so the overall sense seems to be that folks have gained weight during the course of the pandemic. There was a study published using data from California. I don't know if any of you have heard of Kaiser Permanente, but it is a large health system in California. And they had data on close to 200,000 kids and basically demonstrated that kids had a greater increase in their BMI or body mass index, which is a measure of your weight as relates to your height during the pandemic versus prior to the pandemic. And that equated to about a 5-pound weight gain beyond what would typically be seen. Subjectively, I will tell you, we definitely can tell kids that have been affected weight-wise by the pandemic in terms of the weight gains we're seeing in the office. And for many of us, this really very simply was due to less movement. So you guys know, you were walking so many steps that you didn't even think about before the pandemic shut things down, right? You go from your house to, drop the kids off at school. Even if the kids were riding the bus, right? They're walking to the bus stop, they're getting off the bus. Then maybe like my kids to soccer practice afterwards where they're running around for an hour, then maybe over to piano lessons, but we were on the move. And then all of a sudden the pandemic hits, and this is our sphere of movement, right? Like basically we're all circling the kitchen. And what I see in the office from this is, kids who've gained a little bit more weight. So maybe I'm seeing them cross up one of those percentiles on the growth curves our pediatricians use. I'm seeing some mildly elevated blood pressures, whether from the weight or just general anxiety at being in the doctor's office with all the things they're hearing about the pandemic. And the truth is, our kids really weren't moving. And I heard from so many parents how much they felt their kids were snacking because they were bored. So when we started to have this conversation at this point, as things have opened up and kids have gotten back into school and a lot of sports have resumed, I raised the question, your teens gained a little bit more weight than we anticipated during this pandemic time. And, that's happened with a lot of teens. How can we help out? And so I'm going to go through some of the standard responses I get when I raise this and why I like to maybe not have this be our approach. So one of the first things I hear from teens is, well, yeah, I know, and I've been wanting to join a gym. Well, the thing is, from both a parent and a teen perspective, having your 14 or 15-year-old join a gym is really not helpful because the onus is on you then to get them to the gym. So I really try to steer folks away from this idea that they're going to join a gym down the line. And then all of you know how unlikely it is that your teen is going to necessarily stick with this plan to go to a gym on a regular basis, especially if they're relying on you to transport them there. The other thing I often hear is, yeah, she's looking at joining a winter sport, and that's if we're having this conversation in the fall. And if I'm having it in the winter, we're looking at joining a spring sport. So again, I think school sports are fantastic. I think, any opportunity for rec sports are fantastic. But what I really would like to do is push kids and parents to think about things they can implement immediately, because often that opportunity to join the sport is still several weeks out. My other favorite one that I get from parents is, see, I told you, you need to stop playing video games and go play outside. And it may be that your kids are way better than my kids, but I literally have to pry them off the video games and have to be watching the time. I don't know any teen that is going to voluntarily put down the video games. So unfortunately, I feel like this is a space where it's not on the kid to self-police. It really requires the parent to be like, the game is going off now. My other favorite one is, yes, we plan on being more active when the weather gets nicer. And the fact is, we are not in California, folks. We are in central Pennsylvania, and the weather is never nicer. It is always too cold or too hot or too windy. So my suggestion with that one is invest in some good outdoor clothing that can support you regardless of what the weather is like. So you should know that the physical activity recommendation from the U.S. Department of Health and Human Services is for children and adolescents to get 1 hour per day of moderate to vigorous physical activity. And so what does that actually mean? It is brisk walking, running, swimming, jumping rope, which is really hard to do over a prolonged period, dancing, gymnastics, soccer. So the kids are supposed to be pretty active. Now, I completely appreciate that if you haven't been very active or have gotten into kind of this COVID rut, that it's going to be hard to go from no activity to doing something like this right away, but you don't have to do that. So some strategies to think about if you have noticed that maybe your teen is gaining a little bit of weight, or even if they're not, but they just have kind of fallen back in terms of any regular activity they're doing. And again, the emphasis for me is on starting a practice that they can sustain long-term, because that will be good for their health long-term. The other key thing is, I think it's very hard to tell your teenager to be more active if you're hanging on the couch after work, watching TV. So my preference is that this would be something that maybe you do with your child, I wrote here, or teenager as much as possible. So the one really easy thing is to just get up and move, right? It's getting cold. I think it's easy to want to stay on the couch, snuggled under a blanket and not move a lot. But if you can get yourself moving, almost anything you're going to do, a little bit of light housework, have your teen help you prep dinner, take a walk around the block is going to burn more calories than sitting down and being on a screen or not moving at all. The big thing I ask kids to do is start small so they can be successful. So, maybe we don't want to start with a 20-minute walk, but we're watching a show every afternoon after we get home from school. Can we do the stairs during the commercials? Could they take a leisurely walk? Could they take their phones with them and, put in the earbuds and talk to a friend while they walk? Could you guys do a dance party, especially if they're younger siblings? Like, I appreciate doing a dance party with your 15-year-old may be odd, but could you get the younger siblings involved and just get people moving? So again, the idea is just to increase your activity and try to get them to buy into that just a little bit. The other thing I really commonly hear from folks is, okay, we can increase our activity, but we really don't have any time in our day. So, I thought about 3 places where maybe we could make time. So, I know many of you are parents, probably running your kids around at this point, hopefully a little bit more like pre-COVID to activities. Are you sitting in your car with another kid while one child is at an activity, a music lesson or a sports practice? Is there the opportunity to get out of the car with the kids you're with, your teen in particular, and walk a little bit with them around the field, or, do something active other than sitting in the car? Do you come home from work and right away are you heading to the couch? Like, could you throw your sneakers in the car, put them on before you leave work, and then call to your kid and have them come out maybe in the last little bit of light and spend 20 minutes outside shooting hoops with them or taking a quick walk with them? Is there some way to weave in just a tiny bit more activity than you're doing? Because once you get started, it will make it easier to keep going. I put this little link in here, and we don't necessarily have to click on it, but the other thing with this time of year is that, it often is really cold. It often is dark by the time folks are getting home from work. YouTube has a whole bunch of videos. I'd suggest as a parent kind of vetting them. This was one I found by a teen that, I watched the initial portion of it, looked very appropriate. It's workouts for teens done by teens, but there are lots of them like this that are, 20 or 30 minutes. There was one put out by a health system, actually. And again, any small bit of movement that you can get your kids to commit to, preferably with you, will be helpful. So again, just some strategies that I started to try to put forth to parents in the office to try to get us turned around from where we ended up with COVID. The other piece I would draw into this is that nutrition really pairs with the physical activity. So again, some real easy suggestions are to have kids cut down on the snacks or be aware of the snacks that they're getting. I know my kids come home pretty ravenous from school and are ready to raid the pantry for anything and everything they can get their hands on. But if you can, and again, especially for an adolescent, if you can get them to be a little bit more cognizant of what they're snacking on, that may be helpful. The other really easy trick is to have the kids drink a real large glass of water before any meal that they're eating. That will help kind of slow stuff down, make them feel a little bit more full and help with overeating. So that's my 2 cents on the physical activity piece. I'm gonna now just dive a little bit into mental health. So in terms of the pandemic as a whole, what they have been reporting and seeing in at least the medical literature is that at the start of the pandemic and in the months that followed, there were definitely a greater proportion of mental health related emergency department visits for children and teenagers. And what they were seeing in primary care offices, and I would echo in our own office, was that a greater percentage of adolescents were screening positive for depression and suicide risk than we had seen in the past, which was definitely concerning. And I think many of you know the why behind this, lack of time with friends. There was a lot of fear and anxiety about the pandemic and what kids were hearing on the news. And then we saw a lot of kids with a lot of anxiety related to school grades, especially with the virtual learning that was being thrown at them. This year, I've seen anxiety in terms of transitioning back to an in-person instructional model and trying to adjust to that. So, plenty of reasons why. One of the things that I continue to find challenging, I feel like any parent that I would ask, if your kid breaks a bone, what do? They know exactly what to do. And if I turn that around and say, if your kid's having a mental health crisis, what do? I get this kind of blank look because it doesn't seem to be as clear what we're supposed to do in those cases. And so that's a little bit of where I'm going to go. So what are the steps? My kid is anxious to the point I can't get them out the door. They're depressed to the point they won't get out of bed. Like, what do you need to do? So real simple, if your kiddo is suicidal, they go to the emergency department. If you're dealing with depression and anxiety, that's not a crisis situation. There are actually quite a few options available to you at this time to help your teenager. So the first is a school counselor. And so many schools have implemented curriculum or are trying to add in additional components to deal with the anticipated increase in mental health concerns coming out of the pandemic. And I found in many cases that school counselors can be a great resource in this space, especially if your student or your teenager just needs the opportunity to talk things through with another adult, especially if there's school concerns that would be best addressed by an adult in a school setting. I also want to make you aware of the student assistance program. My conversations with parents suggest that few people know about this. So this is a statewide program in all Pennsylvania schools. Every school has a student assistance program. Usually the counselor would be part of that, but they're really intended to be there to help kids work through barriers to their academic success, including mental health concerns, and can often provide linkages to school-based counseling. We've gotten quite a few kids into school-based counseling recently, or community-based services to assist. And of course, then there's us in primary care. And I feel like, maybe the pediatrician isn't the first person people think about when they think about mental health concerns. But if I were seeing your kiddo in the office and you were coming in because there were concerns for depression or anxiety, this is kind of what you might expect during the course of a visit. So our office uses some pretty standardized screening tools for depression and anxiety. They really are detecting symptoms, and for me are not necessarily diagnostic, but give me a springboard for a conversation. So, I would have your team fill these out, and, we would start to talk through some of this, and I would talk through with you both about really important things when you talk about mental health and teenagers. So how's their school performance? Are the symptoms so bad that the grades are going down, or are we just having some mild anxiety that you're noticing is making it more difficult to get out the door in the morning? What about some of the other things they do? Time with friends, activities, how is their participation in those spheres? We would talk some about family history. So, this is not, earth-shattering to anyone, but often, things like anxiety run in families. So anxious parents who struggled with a pandemic, it wouldn't be unheard of that their kids may have anxiety as well and are struggling with some of the same things. And then, I find that parents have often already tried many strategies to support their children and teens when they're struggling. And I will often ask what you've done already. In terms of what we can offer. So again, not all of this would be novel to you. Therapy is a big one that we suggest to teens, especially if we feel like the symptoms don't rise to the level of warranting medication. And I never really love to have medication be my first pass. If we can get a kiddo into therapy and get them some strategies to help cope with their symptoms. Our office has a list of therapists. You can call your insurance company for a list of therapists. And I always encourage people, and want to emphasize this, depression, anxiety, if your teenager truly has one of these diagnoses, is like any other chronic illness, like asthma or diabetes, right? There are days when your blood sugar is under great control. There are days when it's out of control, right? And there may be many factors that influence that. And so mental health is no different. It responds well to treatment, but it's something that needs to be managed like any other chronic illness. There is the option of medication, and most primary care physicians at this point in time can manage basic anxiety, depression without needing to send you to see a psychiatrist. So you should be aware of that. And then, there are plenty of folks I talk to that are like, this is really nice, Dr. Sekhar, but we're not ready or interested in any of that, and that's fine. I just want to make you guys aware, we here at this practice, and there's the option for this as well, for folks even who don't come to Hershey, There is the opportunity to use integrative medicine. So, things like mindfulness and meditation to help with some of these symptoms, again, depending on the level of symptoms. I also very routinely recommend to some of my teenagers apps. Calm is a big one that I recommend that, if they're not ready for any of this, they can download and do on their phone. Calm has things like a nighttime meditation. I know a lot of kids are having trouble getting to sleep. So, if they prefer to be more private about it and there's no emergency, like if they want to try to work through something like that to settle them out at bedtime and calm them down so they're able to go to sleep better, that is another option that's out there. So I know we don't have a ton of time together. So those were basically, my practical strategies and some of the things we've been doing in the office setting to help kids in the space of mental health and physical activity in terms of bouncing back from the pandemic. And that's everything I had for you at the moment. I'd be happy to field any questions if folks have some.
Great. Thank you so much, Dr. Sekhar. Any questions or comments? Please feel free to use the Q&A. All right. I don't think there's any. I don't see. Oh, we have one coming in. Someone asked, what about younger kids? I have an almost 5-year-old that backslid when going on the potty.
That one's interesting. So I'm trying to think. So we are seeing, so yes, I talked to a mom yesterday, actually the 5-year-old whose child is having trouble too. I think probably with a 5-year-old, if I were going to suggest something, I would want to ask you some about consistency or routines that changed during the pandemic. And if there was a trigger to the backsliding, because probably that would be the thing to start with addressing. And then the toilet training is tricky. And again, we would probably need to delve into this a little bit more, because if your 5-year-old has figured out that this is really a point of tension and something you really want, sometimes they're resisting you on this because they have control over their toileting and they're actually stressed or worried about something else. So that would be another piece I'd want to talk to you a little bit about. I hope that helps answer your question a bit.
Great, thank you. All right, we have another one. Do you have any recommendations specifically in an only child situation where throughout the pandemic, they have been truly the sole focus and socially hadn't had to be mindful of others?
So I would probably, if it was feasible for you, try to start to put them in situations where they're going to have to do some more interaction. And it might have to be slow. And again, this would be something I'd want to talk through with you, right? So is there the opportunity to put them in a 1-hour lesson where it's a sport like tennis or karate, where maybe they have to be around other kids, but don't have to do a ton of talking, something like swimming, if you'd be comfortable with that. Or, if you're wanting it to be even more social than that, is there the opportunity for an after school club or scouts or something where, again, they're interacting, but it's supervised and they will start to have the opportunity to think about others a little bit more in their interaction.
Okay. Any other final questions or comments? All right. With that, we thank you very much, Dr. Sekhar. We really appreciate you giving this very timely presentation. As I mentioned before, we will be sending a follow-up email that includes the recording along with the slides and an evaluation survey. We really, truly, your feedback is really beneficial for us as we continue forward with these lunch and learns. And before I hop off, it looks like we got 2 more questions. So since we have time, we'll address those. Do you have any recommendations for a child that doesn't want to do much after school activities because they are away from home so long at school?
Yeah, so a couple suggestions. So if there's the opportunity, depending on the age of your child, for you to be like a parent coach at one of these activities that you're trying to get them to do, or like, involved in some way. So they feel like you're there, but you're still getting them out of the house to do something. That would be one idea. Thank you. So that might be an option for a 7-year-old. The other one is to maybe, for most of these activities, if you can still be there around, even if you bring your laptop and get some work done, or, do whatever it is you want to do, maybe just knowing that you're there would be helpful for the 7-year-old. So they don't feel like you're dropping them off at the next thing where, you're not there and they're missing out on that time with you. The only other thing I could think about if you can't physically be there would maybe be to give them a choice and just let them know that you feel like this is important. How about you pick between A, B, and C, and this is going to be, one time a week, and maybe start small with something like that. Like something I'm thinking of things like soccer shots, where I know the parents often hang out or around, or it's really just once a week. Might be a nice activity to do, or again, a swim lesson or like a rec basketball type thing. Thanks, Francis.
All right. I think that might be all. So again, thank you, Dr. Sekhar. Thank you, everybody. Have a great rest of your day.